myths of a concussion. There are several misconceptions surrounding traumatic brain injuries or concussions. Number one, you need to hit your head. Actually, a concussion is the movement of the brain within the skull. You can take a blow to your chest and have the brain shake within the skull and cause a concussion. So you do not need to hit your head. Number two, helmets prevent concussions. Actually, helmets are helpful. They can prevent skull fractures and other injuries. But as you can appreciate, the brain can still shake violently within the skull and cause a concussion, even if one is wearing a helmet. Number three, you need to get knocked out or have a loss of consciousness. Actually, the data tells us that up to 90% of concussions have no loss of consciousness. Number four, everybody recovers in 1 or 2 weeks. We will often have people say, well, if it's taking longer than 2 weeks, then it's probably not a concussion. Actually, it is true that 80% of concussions recover within 1 to 2 weeks. However, 20% go on to have symptoms beyond 3 months, and in some cases, many years. Number five, concussions only happen to athletes. Actually, that's not true. It is true that mostly concussions covered in the media and elsewhere are about athletes because a lot of us watch sports. However, concussions happen to everyday people with high frequency, whether it be school teachers, police officers, personal support workers, or others. Number six, concussions only happen in contact sports. Actually, the data tells us that female soccer players in some studies have a higher incidence of concussion than male football players. Number seven, you need to do a CAT scan or an MRI. Well, it is important to do these studies to rule out other injuries. However, in almost all cases, concussions do not appear on CAT scans or MRIs. Number eight, concussion is an invisible injury. Well, this is a bit of a challenging one. It is invisible because on the outside it looks like people are fine. However, there's something going on the inside. But there is technology like a SPECT scan, which is more advanced than an MRI and a CT. And in 59% of cases, it can acutely diagnose a concussion immediately following injury. And after 1 year of persistent symptoms, in 95% of cases, there are findings. So therefore, it's not an invisible injury. There is something going on. And finally, number nine, when you have a concussion, you should stay in a dark room. This is not true. It is important to engage in moderate levels of cognitive and physical activity, have a treatment team around you in order to recover. These are 9 myths of concussions.